Sonia, I'm going to be your nurse. I'm going to go ahead and close the door for privacy. And I'm going to go ahead and do your hygiene. I'm going to go ahead and have the patient state their name. Mary Potter. All right, Mary Potter. Can you state your name and date of birth? Well, your date of birth, 9/9/1999. All right, I'm going to go ahead and check your thing. And yep, your name is Mary Potter. All right, I'm going to go ahead and before I came in, I had checked her medical record and seen everything that would concern me or would not concern me. And now I'm going to go ahead and let her know what I'm going to do. So I'm going to go ahead and let you know that I'm saying that we need to do an assessment. Is that all right? Do I have consent? She says yes, and I'm going to go ahead and ask her if she can get up and go and do her take her vitals and her weight. She says yes, so we go get her weight and I do her vitals. Since she is up, I'm going to have her walk for me back and forth, making sure that she doesn't have a preference on a hip. I'm going to have heel to toe. Heel to toe, making sure she's well balanced. And I'm going to have her lift one leg and the other while being guarded. So checking for balance as well. I'm going to go ahead and push on her shoulders, making sure that she comes back too, that she's well balanced as well. And I'm going to go ahead and come back to her and ask her if she's in any pain today or discomfort, and she says no, that she's doing well. So I'm going to go ahead and let her know that the assessment is done from head, working my way down to her toes, and that if at any point she has any pain or discomfort, to let me know. We can stop at any moment that she likes. And I'm going to go ahead and start with your hair and your head. So I'm checking her head, and I see that her hair is evenly distributed. She doesn't have any lesions, abrasions, and she doesn't have any bumps, lumps that would concern me. I'm going to check her ears or infestations. Checking her ears. Her ears are symmetrical in place, and I'm going to go ahead and palpate her sinuses, upper sinuses. Let me know if you have any pain. She states no. Lacrimal glands. She says no. All right. Checking her eyes. Her eyes are her sclera is white. I'm gonna go ahead and perform nerve 5 and 7, and I'm gonna go ahead and have her tell me if she feels where she feels this. So she says forehead, cheek, other cheek, chin. All right. Well, her eyes were closed, and I'm going to go ahead and ask her if she can raise her eyebrows, cover her cheeks, frown, smile. She does it all. Good. I'm checking for symmetry, no droopiness. All right. I'm going to go ahead and check for her nose, if there's anything that I should be concerned about. Dislocation. The symmetry is well. It's in place. It's intact. I don't see anything that would concern me. I'm going to go ahead and check her mouth. All right. Her mucus, her gums are pink, and her teeth are all intact. Good oral hygiene. Can you stick out your tongue and say ah? Checking her gag reflex. All right. And I'm gonna have you go ahead and try the sample. She says okay, and then she tries it. She says it tastes like bananas. All right. I'm gonna go ahead and check your ears really quick. Tympanic membrane intact with a little bit of serum, which is normal. And then I'm going to go ahead and check her nose, making sure she doesn't have any polyps or anything that would concern me. No. Her nasals are nice and pink, and with that, her mouth is also nice and pink and moist. All right. So I'm going to go ahead and have you look at the chart and tell me the smallest line you can read on this non-chart. She reads the smallest. Good eyesight. Have you go ahead and read my badge. All right. She says she can read my badge. And I'm going to go ahead and ask her also if I can check for symmetry using the Weaver test also, and her hearing. Right. She says she hears it in both sides. Okay. And again. right. She says that she can hear it on both sides, both ears. I'm gonna go ahead and have you close one eye, continuing on with the eyes as well. Check for Perla. Go ahead. This one eye. All right. Good. All right. I'm gonna go ahead and have you follow my pen. Checking the 6 points. Can you? All right. So her eye accommodation is right. I don't see any her eyes doing jotting or anything. All right, and I'm going to go ahead and continue on with carotid, checking her carotid. All right. Okay, nice and strong. Checking her lymph nodes. All right, I don't feel any bumps or lumps. Checking her thyroid. Okay. I don't feel any lumps or bumps on her thyroid either. Can you shrug your shoulders? Yep. All right, I'm going to go ahead and also listen to your heart for any murmurs or anything. All right, so aortic, pulmonic, Erb's point, tricuspid, mitral. All right, like I stated, I don't hear any murmurs, anything that would concern me. I'm going to go ahead and listen for her carotid, for any bruits. Okay, if there are none, I'm going to go ahead and check her thyroid. Okay, I don't hear anything as is normal. And I'm going to go ahead and now, since I have you laying still up, I'm going to go ahead and inspect your abdomen. So on inspection, there's no lesions or abrasions or any lumps or bumps that it would concern me. I'm going to go ahead and listen to the 4 quadrants. All right. I don't hear anything abnormal, normal bowel sounds. So with that, I'm going to do you have any discomfort? Pain? Okay. Go ahead and check. Let me know if you have any pain. No? All right. So I'm going to go ahead and listen to your lung sounds. All right. I don't hear anything that would concern me. I don't hear wheezing, crackling. I'm going to go ahead and have you sit up. I'm going to go ahead and take a listen. Okay, like I stated, I don't hear any crackling or wheezing. I'm going to go ahead and feel around on your spine. I don't feel any lumps, bumps, nothing out of place. I'm checking for scoliosis and kyphosis and lordosis, and I don't see any of it. And I'm going to go ahead and palpate. Let me know if it hurts. Okay, she says no. I'm gonna check with kidneys. Any pain? She says no. All right, I'm gonna have you go 99, 99, 99, 99, 99. All right, I'm gonna go ahead and check for evenness. Breathe in. Okay, breathe out. All right, it's even. I'm gonna go ahead and cover you back up. I'm gonna go ahead and have you sit lay back down. I'm gonna check, while she sat up and laid down, I checked for abdominal extension and distension. Seems like she's, well, her abdomens or her muscles are as they should. And I'm going to go ahead and check her neck for any jugular distension. Can you look both ways? She said, okay. I'm gonna go ahead and, okay. Can you shrug your shoulders for me? Okay, she shrugs her shoulders. I'm gonna go ahead and check her brachial, radial. They seem nice, even and strong. I'm gonna go ahead and check her strength. Can you squeeze my hands? Yep, okay. Can you, I'm gonna have you push up on my hand, okay? Have you push down on my hand, okay? I'm gonna go ahead and have you lift up your arms straight up, okay? Now to the sides, all right. And I'm gonna have you move your wrists up and down, all right? On both sides, all right? All right. And then I'm going to go ahead, while working my way, I'm gonna check for turgor. So I'm gonna go ahead and check for turgor. All right, she's not dehydrated. And while I checked her upper extremities, there's no discoloration. Her skin is pink and her temperature, she doesn't feel out of range, not too hot, not too cold. Okay, while I'm working my way down, I am going to ask her if she has any swelling or pain on her legs. No. Do you have it? I'm checking for edema. There is no edema. I'm going to go ahead and have her flex her lift up your legs, your feet. Now down, gas pedal. All right. Now I'm going to have you move them in a circular motion, which she does. Now I'm going to go ahead and have you wiggle your toes. She does. I'm going to check for medial dorsal pedis, and then I'm going to go ahead and check posterior tibial. I'm going to check femoral. Okay, all of them seem nice, even and strong, and I can feel them. So I'm going to go ahead and have you raise your leg for me, and she does. Okay. Now I'm going to have you go ahead and, while checking for her hips, can you abduct, please? She does, and then it's on both sides where she does it. Right. And now from there, I'm going to go ahead and with my, I'm going to check for if she can feel where the vibration is happening. All right, she states it's in the elbow, other elbow, wrist, other wrist, ankle, other ankle. All right, and I'm going to go ahead while she's sitting up. I'm going to go ahead and check for her, I guess, movement. So I'm gonna go ahead and do her arms. Okay, she moves. All right, flexion. She moves. All right, now knees. She moves. Other knee. All right. So I'm going to go ahead and also check for her aorta on her stomach for any bruise. Or hums. All right, I don't hear any. So I think that concludes my assessment. I'm going to go ahead and lower the bed to the lowest setting for safety. Okay, and I'm going to go ahead and document, and I'm going to go ahead. Oh, quick question: if you have any pain after assessment, are you in any pain? She says no. Okay, so I'm going to go ahead and continue document hand hygiene, and thank you.